Welcome to the Paternal Conversation Series. My name's Simon von Solden, the CEO of Healthy Male, and your host for this, our final webinar in the conversation series, Social and Mental Health, a Paternal Lens. Now, before we get started, I'd like to acknowledge the traditional custodians of the various lands on which we work today and the Aboriginal and Torres Strait Islander people participating in this webinar. I pay my respects to elders past and present and emerging, and recognise and celebrate the diversity of Aboriginal peoples and their ongoing cultures and connections to the lands and waters. Now, you'll see a pop-up screen that will pop up very shortly. And if you could please take the time to quickly fill that in. It's a real quick one, so it won't take you long, but it actually gives us a good idea as to what you're interested in today's webinar. Now, as I said, this is our final webinar in a 5-part series. For those that have been with us for each one of the 5 webinars, thank you very much. And for newcomers, I'll just run through a little bit of housekeeping for you. So the series is recorded, and for those joining us today, you'll get an email advising you of when this is available on the Paternal webpage and the Healthy Male YouTube channel. Now, please feel free to share that information amongst your networks. And actually, we've got a new question this time around in the feedback survey at the end of the webinar, which we'd like to know if making these available as podcasts is something of interest to you or something that you actually think might be useful in your networks. So just keeping on the housekeeping front, now you'll see there's a chat function in Zoom. Now, that's available for questions, for you to type in questions for the panelists. So, as I've said many times before, and I apologise to people who've been with us all 5, you've heard this all before, but it's probably at the bottom of your screen if you haven't changed your settings with Zoom. And as you do this, just click on chat, type in the question. Now, only we can see it. So just feel free to say what you want to say. Ask the question. Questions are good. Things with question marks at the end of them. And we'll get them through to the panelists where we can. So basically, we want you to become keyboard warriors and get cracking on that keyboard and tell us basically what it is that you want to know. What sort of things do you want to use these people? And we've got, you know, 3 very, very good people in the area to get some more knowledge out of them. So something I like to also always impart on people is just to say that Paternal is not about taking anything away from mothers and babies. It really is about adding to that process. So we recognise that the health system is structured in a certain way to benefit mothers and babies, and we're not saying that part of it needs to change. We're saying that there's parts for the fathers that actually need to look a bit different. So I'd now like to introduce to you our panelists for today's session, and they are as follows. We have Jackie Mead, who is the Chief Executive Officer of SANS Australia, and Jackie is a bereaved parent herself and the CEO of SANS Australia, an organisation which delivers nationwide support to bereaved families following pregnancy and infant loss. SANS delivers much of this needed support using well-trained and committed volunteers who themselves have experienced the tragedy of losing a much-loved baby. SANS has specialised men's services, including phone and online support groups where men support other men. We're also fortunate to have Luke Rigby with us. Now, Luke is a dad of a 2-year-old daughter, and both Luke and his partner experience postnatal depression. Luke's been actively involved with Dad's mental health movements, such as the Dads Group, and he's also helped us out at Healthy Male a few times. And finally, we have Narelle Dickinson, and Narelle is a health and clinical psychologist and member of the Paternal Advisory Group. Narelle practices in Brisbane, and over the past 25 years, she has practiced across government and non-government settings in the areas of mental health and perinatal and fertility support, and currently operates a private psychology practice providing support to families during their perinatal and fertility journey including specialist counselling for family creation using donor conception and surrogacy. She's particularly passionate about supporting families in the context of perinatal grief and loss. So, welcome all three, and I'm just going to use a collective noun for you now. And thank you very much for spending a time with us today. So I'd like to get started by asking a question, and look, I might start with you, Narelle. I really want to start about talking about the experiences across the journey to fatherhood. And is there sort of any areas specifically that can be more distressing to men than others?
Yeah, hi, thanks for that. Look, I think the transition to parenthood is for most people the biggest change we go through in our life, whether we're becoming a mum or a dad. And there's times where within that I think those interruptions to the expected journey are really challenging. So if we're having problems with our fertility, if the pregnancy is more rocky than we expect, there's some unexpected diagnoses turn up, if there's a loss of a pregnancy, or if that transition afterwards is more difficult than we expected, that our mood deteriorates, it brings challenges we didn't expect. I think those are the times that people particularly start to struggle. That's certainly when we start to see people coming in and looking for help, not really managing things very well.
Thanks, Narelle. And Jackie, because you have a specific niche, I suppose, in terms of father's journey and where it might be, what do you see in that context? Sorry, the words of 2020 is you're on mute.
Sorry about that, Simon. I think there's two aspects of this. First of all, for many fathers, it's a new experience, and so they don't know what they don't know. All they know is that for whatever reason, as Narelle said, they're facing overwhelming and different emotions to what they perhaps feel equipped to deal with. And that's certainly the case when we're talking about baby loss, whether it's during pregnancy or shortly after. It becomes much more complicated because there is such a strong focus on the mother and on the baby. And in fact, the thing that fathers tell us more than anything else is that the number of times they're asked how the mother is travelling, rather than people making inquiries about how they're travelling, is one of the things that continues to put them into that caring role rather than being able to look after themselves and feel comfortable about looking after themselves and asking for what they need to. Of course, it's also a time where there is absolutely massive pressure on relationships. And again, this can put us into different camps if we're not understanding what's going on for each other.
Yep. Thanks, Jackie. That's great. And I suppose, so Luke, you've got a specific lens on this as well in terms of you suffer from postnatal depression. But in context of the question, like talking about the experiences during the journey to fatherhood and what could be distressing for men, was there any, I suppose, starting earlier than when you recognised that you had, and probably for the purpose of the audience, I might get you just to tell them in terms of what happened with you, but was there something early on that you now look back at and went, yeah, okay? Yeah,
of course. So for context, I was diagnosed with postnatal depression in about February of this year. My daughter was born at the end of 2018, so it was a full 14-month period where I was sort of battling this thing that I didn't really know how to deal with. My partner herself struggled with depression and anxiety before pre-pregnancy, so she was very clued onto what she was experiencing and the conflicting emotions that she was going through. But looking back, the pathway to parenthood is sort of traumatic the whole way through. Like, no matter how you look at it, whether you're a mother or a father, from the moment you find out you're pregnant, your life is upended. It's like as if a whole new life has started again from that very moment. So you've got to look at, the personal pressures, the social pressures, the financial pressures, the relationship pressures, and they sort of all accumulate into this sort of feeling that if you've never experienced depression like I didn't pre-baby, you don't exactly know how to recognise properly.
Yep. Yeah. And Jackie, you wanted to add something to that?
I did, Simon. I think one of the other really important things for us to know is that so often men are told that they don't have the same connection to the baby because they haven't had the physical experience of pregnancy. And in fact, most men tell us that, you know, seeing those first ultrasounds and, you know, feeling their baby move and their excitement and the mental pictures in their own head about what fatherhood is going to look like are equally as strong for men as they are for women. So anything that interrupts that, whether it is mental health issues or it is baby loss, have a profound impact. I certainly know my husband had much stronger mental images of what fatherhood was going to look like than I had about motherhood. You know, within days of us finding out that we were pregnant, he was talking about what it would be like to have his 16-year-old daughter and be talking to her when she was falling in love for the first time. And, you know, I was still at that point just struggling with water. So I think that it is really important that we understand that these interruptions very much have an impact on the relationships that men have with their babies, and that is another loss that they can feel.
Yeah, yeah, it's a really good point. It's and we've seen this through the webinar series that there's lots of different touch points for men through the journey. Now, when I opened up, after I'd given my little spiel at the start, I opened up the chat session, and already we had a question waiting for us. So, and the question, it's worth having a bit of a chat about this, because we've been asked to, if we could actually tell how counsellors and psychologists can better support fathers. So, Narelle, again, I'm going to start with you on this one. And seeing as, you know, it sort of does fall right in your backyard, but I'm sure there's other experiences.
Look, I think for counsellors, the thing that we need to do is ask. And I think, unfortunately, sometimes that's just a little bit overlooked. There are some systemic issues for that. It's often that the treatment we do, if someone's presenting, if a mum is coming in not feeling so great in the time after Bub's been born or during the pregnancy, she will often attend as an individual. She, you know, it's not necessarily usual for a partner to attend. So that opportunity for that first-hand checking in of a dad is not always there. So I know for myself, one of the things I do tend to do is ask, if I'm working with a mum, to ask, well, how does she feel like her partner is going? Does she feel like he's doing okay? Does he need some support as well? And so I think it's remembering that the family exists as a whole, and when everyone's well, everyone starts to do a little bit better. When someone's going down, unfortunately, we might all start to go down together. So I think there's a big responsibility on counsellors and other health professionals, actually, that we're checking in on everyone within that family unit and not just focusing on the mum. Yep.
And Luke, your backyard on this one basically is a little bit different, but interesting perspective.
Yeah, essentially what I just wanted to add in was, if you take the definition of counsellors and you broaden it out a little bit into sort of the direct social network, say partners and close friends, I found personally, and through the guys that I've talked to, that they were always the first stop before you go to a health professional per se. So that's essentially that first step, is checking on your mates, and then going from that and supporting them going through the more formal pathways.
And was that, so on that, Luke, did you find that as being a helpful process to talk to your mates? I mean, sometimes I've heard people say, you know, they're the worst people to talk to because they don't know how to actually give advice or help, or they try to solve your problem.
Yep.
Was that useful to you?
Personally, yes. I am both lucky and unlucky to come from a generation where the there's less of a mental health stigma when you talk to your close friends. So having that support network that I could more readily bounce back towards was personally beneficial.
Yep. And Narelle, you wanted to add something to that?
Yeah, I think I was just reflecting on a lot of the families that I've seen going through either infertility experiences or the time after they've had a pregnancy loss. And for those dads, it is often their peer networks that they reach out to. And for those men, I think they're often surprised by how many of their peers, their friends, their workmates have had a shared experience. It's that whole, it's what Jackie said before, you don't know what you don't know, but it's only when you start speaking about what you're going through that you suddenly realize how many other people have been through something similar and actually really do have something to offer. And it's actually often in that context that it's the friends who've said, you know, look, mate, I think maybe you're not doing okay. You actually probably need to talk to somebody else. Maybe it's time to talk to a counsellor. So that's often been the trigger for people getting that support that they need more directly.
Yeah, and it's interesting that Luke's point of, you know, I think his generation is much better in terms of acknowledging mental health issues, and I hope that's made life a bit easier for the new generation of dads, because I think some of the stigmas that were there previously closed doors for themselves. And Jackie, so what have you seen in terms of that?
Interestingly, COVID-19 has provided us some different insights, I guess, into engaging men. And one of them in particular has been that as we've been doing a lot of online webinars ourselves or psychoeducation sessions or groups, that they might start with mum and all of a sudden we'll realise that there's somebody sitting just slightly off screen. And so we've been able to very gently begin to pull those people into the community and to find that actually there's many fathers that are sitting out there as well. So men have been telling us that actually the online environment for them is less confronting and therefore they're more willing to engage in it. You know, rather than needing to turn up to a support group or walk into a counsellor's office, that, you know, they can be sitting in this Zoom space, and if they absolutely hate it, all you've got to do is disconnect and it's over. So apparently that's been a little easier for people to come to terms with. Now, I'm certainly not saying online is suitable for everything, but certainly the less intensive options seem to be more appealing. There's also been, you know, really strong support around things like SMS for Dads, which is, you know, a platform that's sending out messages occasionally and is less intrusive than perhaps some other ways that we can communicate with dads. So I think it's just really important that we don't just ignore them, but that we don't assume that the same things that work for women are going to work for men in terms of engaging them in services and supporting them to seek support.
It's a really good point, Jackie, and it's one that we come across a lot in terms of people saying, you know, they want to make male-friendly environments. And I get sick of hearing myself say this a bit, but it means more than putting a Wheels magazine in the reception room. You know, there's a hell of a lot of things that need to be done, and it is things like time of day that you're available, the method of communication. All of these factors need to be played and thought about in terms of engaging men. So on that, in terms of engaging men, and I'll stick with you on this, Jackie, just to start off with. I was going to ask what's currently available to support fathers and prospective fathers, but I want to cast it back a bit because you're in an interesting position where you started an organisation and I'm guessing because there was a lack of support.
So SANS started 40 years ago for that exact reason. Bereaved families saying, you know, this is crazy, there's nobody to help us and we feel so isolated. And so they began setting up peer support services at that point. I guess what became even clearer, you know, probably over the last 10 years in particular, is that there was, that men in particular needed some more specific things. And at that point, we started a men's support line where we knew that a dad could speak to another dad or a man could speak to another man with lived experience, and that was somehow important. It's not that our everyday peer supporters aren't happy to talk to them, but there is something about being able to talk about the things, you know, particularly frustrations, etc., that you're having, and knowing that somebody else gets it because they've been in a similar situation. So from there, we then started to have men saying, well, you know, we want to be able to develop those relationships a little further. And that's where the online group idea, I guess, has really been generated from, as well as providing particular resources in terms of fact sheets and things like that. And again, Simon, I think you have a similar experience. So this is another place where even the language that we use when we talk about these things is very female oriented. And so it's more than just changing mother to father. You know, when we're doing these things, we really have to think about what's important to men and what they need to hear about, and that it acknowledges that they're dealing with things on multiple levels. You know, one of the key issues is the issue between mothers and mother-in-laws. And of course, fathers can be trapped in the middle of that every single time. So, you know, there is the extended family that very often fathers are trying to navigate through and provide support to. There's their own needs. Very often there's children involved, and then there's their partner. So they need information about multiple different things, and the information they need is slightly different. So that's another place where we've begun to put some efforts to try and make sure that we are meeting needs.
Yep. And you'll be pleased to know that, and I'm actually going to break one of my own rules here, but say, and Kate Obst, in the time that you're speaking from University of Adelaide, has actually said their research has shown that there's great support for what you're doing and with the work that men's doing. So that's a nice little plug on the sideline there too. But Luke, so on this front, with your specific journey in terms of suffering from postnatal depression, when you first began to realise what was like, where did you go? What did you do? Did you find it easy to find somewhere to get support, or was it all a bit overwhelming and a bit baffling?
More towards the overwhelming and baffling side. Personally, it took, like mentioned, took my partner a year of pestering me to go to the GP before I actually went under my own power. And that was a little bit of a, like, it was mostly me just going, oh, I'll be right, you know, we'll get over it. And personally, I didn't find a lot of external sources outside of going to talk to my GP. Like, there's a few local support groups, including one that I started up here with Dad's Group Inc. There's a couple of Dad's focused counsellors, but they're not very widely known. I've only met them through meeting other people. But it was the most challenging thing was, like, one, that lack of support, and then two, actually went to someone I trusted in my GP and was still afraid of the emotions that I was facing when I was talking to someone I knew. So I ended up in my appointment after a year of, you know, being told that something's not right by someone very close to me and the effects that it was having on our relationship. And I got there and I broke down in tears. Yeah. So it was, yeah, there's a gap would be what I would say.
It's interesting what you've said and what Adam Tardif, who was on one of our previous webinars, and he jumped in a taxi and said that he knew something wasn't right and just took himself off to a GP. And so, I mean, interesting that it was your partner who actually was the person, and an important, you know, probably the most important support person we have in our lives is if you're fortunate enough to have a partner. But Narelle, when men come to see you, what is the referral process? Is there sort of one that you see, oh, this is pretty much the normal way it goes, or is there no such thing?
Look, I think there's lots of versions if you're coming within the private system. If in the case of a mental health referral, certainly approaching your GP and looking to see whether a mental health care plan is an appropriate pathway is a great way to get that private support. And in the circumstances around the perinatal period, that's a really appropriate referral. But you can attend a private psychologist without a referral at all. That's completely fine. You can use private health insurance if you have it, or out of pocket. Certainly going through the public system can be a little bit more difficult to negotiate at times. But I think what Luke did of starting with the GP and seeing what's there is a really good starting point. I think we also need to look at some of the other services as well. And I saw something just come up on the chat there where someone was recommending the Panda helpline. You know, there are some great services out there. Panda is excellent. Beyond Blue is excellent. There's some great information on the COPE, which is the Centre of Perinatal Excellence website. They've got some really, really wonderful material on there and some advice of a directory of support services. So it can be really hard. Even as a practitioner, it can feel really overwhelming sometimes working out who's the right person to, or where's the right person to send someone. But I think the services are there. And as long as we keep asking, if you feel like you go and ask your health practitioner and they don't give you a good answer, don't give up. I know that you're feeling vulnerable and exhausted, and that's not when you're necessarily at your best point to advocate for yourself, but you may need to ask again. And I know for myself, I have networks of psychologists where we talk amongst ourselves and share referrals and find out who a good place to refer someone on to might be. So your health professionals will be able to help you find the right place to go when you're ready to get some support.
Yep. Yeah. And so it's worth noting also that we're just on the Panda front, that it is, next week is actually Panda Week, which I love the name. So it's the Perinatal Anxiety and Depression Australia Week next week, and they will be promoting things around their line for dads. And as you said, Narelle, someone actually had popped in there that Panda has a helpline for postnatal depression 12 months postpartum, but they also do have a specific focus on fathers as well, which is great. And are one of our partners in the Case for Change, which is also fabulous. Jackie, you wanted to add something to that?
I did. I just wanted to acknowledge that one of the things that we hear quite often from men is that seeking support was really difficult because they were afraid, I think, of the experience that Luke described of becoming overwhelmed by their emotions when they began talking about it. And I just want to reassure people that, you know, the people who work in this space, counsellors, psychologists, are really well versed at being able to hold that and creating a safe space if that is what happens, but also at going at a pace that you can handle. So it's okay to stick your hand up and say things aren't quite right without needing to unload everything. They'll ask gentle questions, and it's okay for you to hold some boundaries if you don't feel like you can go the whole way there and still be able to seek support.
And yes, and so for the audience who can't see this, Narelle is nodding so ferociously that she may actually be putting in a whiplash claim to us shortly. So, but it's a really good point. And so it probably brings me, it's a nice segue to the next question, because it's something Luke has touched on. He said, look, his generation is better at it, but he still had the blocks in terms of going to get assistance for himself. So I suppose I'm a bit curious, and I'd like to explore with you all, like the barriers that are there. How much or how much of it's health system barriers, and how much of it is actually the men? That was a general one. I was hoping someone was going to leap to me, but no, I'm just going to go for you, Luke.
I would say 40-60 respectively.
On which front?
40% medical, 60% men. And the reason I say that is on the medical front alone. Like I grew up, I'm in a town of 80,000 people in a state that's only got 500,000 people. We've got the oldest population average age in the country. So we're quite conservative, just in broad strokes. So what I got from my medical journey and my partner's medical journey was a few brochures in a bag that we were given as a collective. One was for the Panda Association, one was for Beyond Blue, and then there was a Facebook link that I happened upon for Beers and Bubs. And that was essentially the breadth of my medical experience, or my medical awareness for what was available towards me. And then 60% for the men would be more along the lines of like the issues that I mentioned before. You've got social stigmas, you've got personal pressures, and a lot of the time it comes down to you're the one who's supposed to be strong and the rock of the group. You've got to be the person that everyone falls back on, and in that there's no wiggle room.
So interesting, Luke. You said you have to be the person that everyone that you fall back on, that people fall back on. Do you think that's an expectation that men put on themselves, or is it actually one that you feel through the health system, or in other places?
Both. And
Yep.
I don't think with the health system, I don't think it's a deliberate action. Like you've mentioned, it's rightly focused on the woman and the child. And therefore the men sort of fill that space that is left. So you go to a formal medical appointment with your partner, and it's all about her and them. But once you leave that, you're the next port of call. You're the support network.
Yep. And Jackie, you wanted to add to that?
Yeah, look, I think that in the space of loss, baby loss, there's very definitely medical or issues within the broader system. So one of them is, that our most recent survey of 1,500 bereaved parents still suggests that men aren't being given information around support services when they leave hospital if they suffer a stillbirth, for example. So there are some really simple things that need to improve there. There's also the fact that given the current situation where men feel such a strong need to provide support, the time that they're ready to process their own grief is different than it is for women. And so the current system where you can go and get a mental health plan related specifically to grief, because grief in and of itself isn't recognised as a mental health issue, and nor should it be, but complications in grief are. If you're looking for mental health support related to grief specifically, you need to do that in the first 12 months. And very often men aren't even up to that stage yet. It doesn't mean they're never going to need support. It doesn't mean that free support shouldn't be available to them. But they're then left with the complications around needing to seek a private psychologist or find funds and all of the other things that come with that. So they're two places where there are systemic issues that need to be addressed.
Yeah, and is that what you find too, Narelle? Would you say it's men sort of, using Luke's sort of numbers, which interestingly, I should say, is that with the surveys that we did with both men and health professionals, so fathers and health professionals and fathers who's experienced loss, so the fathers came in we asked them where they thought, were the barriers, and how they thought the health system had supported them. 43% of fathers said that they didn't think the health system supported them very well. and 61% of health professionals said they didn't think the health system supported men very well. So it was interesting that it was actually the health professionals that scored themselves much more harshly than the fathers. But as actually Tom Docking from the Dads Group did ask the question of those stats, which was, is it that the men don't know what else to expect? So it's kind of, you know, like, I got what I got. So that must be the same for everybody. Narelle, you're nodding your head there. So what are your experiences in terms of where the barriers might be?
Yeah, look, I think in regards to what you're just saying there, I think men probably do accept what they get. They accept this is how it is. This is how it's always been. And particularly if they do come into their experience with the idea that their primary role is to be their partner's rock, to be their support, they may just really be feeling that that's all they were, you know, that's all that was supposed to be offered to them. And I think as health professionals, we are often quite critical of our services, and we know where the deficits are. We often look longingly at the greener grass of other services and see what they can do, and feel the gaps in what we're able to do. So there are a lot of big problems. Even as Jackie was alluding to some of the Medicare limits, you know, I think it's a real deficit of the Medicare system that we can't provide support to couples very specifically within any kind of Medicare rebated system. So that makes it really challenging. The example of a couple who's maybe coming because they've had a perinatal loss, I'm treating an individual under a mental health care plan, not the couple. And so there's all sorts of complexities there in terms of the sort of support that we can provide. So I'm not going to try to pick a percentage split, but I do think we have to share the consumers see their own barriers, or they see whether or not that's a place for them to go. But I do think there are some really big systemic barriers. And really what Jackie was talking about it before, the language of the services, they're so female oriented, mother and baby units, maternal infant health services. There's a creation of a mum's club that just naturally, maybe unintentionally, but naturally excludes men from accessing services, makes them feel like there's an invisible line that perhaps they're not supposed to be stepping over and asking for help from. So I do think there's a significant systemic issue there.
It's interesting, again, some of the previous discussions we've had in this webinar series is language was quite strong. In fact, one of the things, we got some feedback when we were doing our process for the Paternal case for change. And it came from a maternal and child healthcare nurse of some 20 or 30 years experience. And she said that it was the first time she'd actually looked at it through the lens of a father and realised that she needed to actually change the way that she did things and talked about things, which I thought was really quite telling, because, I mean, they've got a massively difficult job. But they're not trained in the area of actually what are the signs with fathers, what are the things they should be looking for. So it is, when we look at the health system, I mean, we need to get back into training and all those sorts of areas, as well as not just sort of dumping on the health system and saying, oh, you've got to change. But I think COVID has shown us that the health system can actually adapt very, very quickly when it needs to. And is actually, so some of our approaches to concern about, oh, it's, you know, such a big beast and you've got to change things and take slowly and it's generational. I think are things that the barriers that we actually put up ourselves. The other one I just want to touch on is something you said, Narelle, which is the second time this has come up. And it is about the client focus and the issue that we are beginning to see now, that there's been some call for, and another few organisations, I think Baby Makes 3 had tried this, where they wanted the hospitals just to acknowledge the father in the letter that went out. And the hospitals said they couldn't do it because the father wasn't the client. So the system it is structured around, and I get it, it's a product-based system in terms of you are recipient of the product on offer. But I think it needs to understand that there's more than one recipient in this case. In fact, you know, in most cases, and I'll be quite broad in that definition, there's 3 recipients. And it is, you know, in terms of nuclear style approach, it's mother, father, and child. So having that sort of approach, I think, would be something that would be a massive leap. So if you were going to say that you could, if you could make some changes, just simple changes, you had the opportunity, you had your, and I've offered the magic wand before in this webinar series, I'm going to offer the magic wand again. But you can make one change. And it was to make the change that, so people who have suffered grief, loss, anything in that spectrum, what would you do in the current system? What change would you make if that was available to you? Now, Luke, you're going to get asked this first because you started nodding your head first.
Firstly, I'm going to apologise. There's a mower going on in the reserve behind my house. I actually had a discussion with my partner this morning about this, and she raised the point with me that the questionnaire that we got given at our 8-week appointment, and then again when we entered the hospital for birth of our daughter, was to do with her mental health, and it was solely around her and her pre-existing conditions. So the thing that I would personally like to change is for the father to also have to answer that screening questionnaire. And then on that, I'd like a second step personally, where there's like an educational follow-up, where you're educated about anxiety and depression, whether it's related to post-birth or grief, and what to look out for.
Yep. Luke, I'd just like to say that in the 5 webinar series, with me offering a magic wand, you are the clubhouse leader so far.
Thank you.
Not sure what you get, but anyway. So Jackie, what would you offer?
I'd tackle it a little bit differently. I think back to what Luke said around how do we actually get men's engagement, and that normally there's a step before they seek services. So I'm really keen for us to engage workplaces. You know, most HR departments have some sense around the signs of postnatal depression in women. And so when women are returning to work, particularly if they're returning pre-12 months, there are all of those conversations going on around how do we make this easier? How are you coping? What's going on for you? And again, this also applies if a baby's lost along the journey. But for most dads, they're returning very, very rapidly into a workplace. They're sleep deprived. There's a whole lot of other things going on at home that they feel guilty about leaving every day. And nobody in a workplace seems to be doing those same check-ins with them. So I would love to see us establish a workplace program that provides some education for people around what this looks like for dads and how they can better support dads. And I think that what we'll find is that might open some conversations that lead to men feeling more comfortable about seeking services and supports.
That's great. Thank you very much. I think you got a challenger, Luke. Narelle, what's your magic wand going to do?
Well, I laid the barriers split between consumers and services, so I'm going to magic wand a double split as well. And I'm a big fan of health promotion. So I think that for services to be assuming that men are going to be part of consultations, not just once things have started to go off the rails, but from the beginning, that it's just an assumption that families attend. Men aren't there as support, they're part of, they're people who are becoming parents. And so if we start with that assumption that they're welcomed, they're expected, and everything is directed towards that shared welcoming of both parents, if it is a couple, that I think that's something that we can do as services. And I completely agree with Luke in terms of assessment and availability of treatment. It's something that we really let men down with in terms of the perinatal mental health. in terms of men themselves, I guess it's that opportunity to be a little bit bolshy and sort of make yourself welcome within those services, and for women to be a little bit bolshy in bringing their partners in with them into consultations, and instead of responding to a level of surprise if a service sees a partner turn up because it's during work hours or because he's taken extended leave or whatever, just treat this as something which is exactly as it should be, because that to me would be the magic future, where this is just how it is. We all parent together and we all aim towards creating these happy little kids who have happy, well-adjusted parents.
Yeah, and actually, and that was a beautiful segue. Thank you very much. I think we'll just pretend we planned that into the my final question for you all, which is how viewers can influence change. So anyone who's watching this today or on the YouTube channel later, what they can do. And I think the first place is, from what Narelle's saying, is there's an element of self. You've got to become a bit more bolshy. I'll use her words, and push yourself into those places. Plus, partners also need to be a bit more bolshy. Again, I got to say it twice. It's fabulous. So now, Jackie, what would you suggest that they can do?
First thing I'd do is reframe on the bolshy and put it in terms of advocacy, because I think it's one of the key parental skills that we need to have. If you can't advocate on behalf of yourself, you can't advocate on behalf of your child, and it's such an important skill to develop and deliver. So why not practice it right at the beginning of pregnancy? It's the start of good parenthood. I guess in terms of what you can do as individuals, I think that we can also all take responsibility as bystanders. It is being prepared to be vulnerable and share some of our own experiences that make it okay for others to share theirs. And it's about us creating an environment where it's okay for people to step into whatever support they think that they need without judgment.
Yep, and that is fabulous. Fabulous advice. Thanks, Jackie. And Luke, I'll finish with you. What have you got in terms of what can people do? Because you've done a fair bit on your own there.
Yeah. What I'd like to say is I just want to echo Jackie's point in what we can do as bystanders, and ask your mates how they're feeling. Ask your partner how they're feeling. But don't just do it once. Do it 2, 3, 4, 5, 10, 15, 20 times. Whenever you notice that something's off, especially if it's for an extended period of time, don't be afraid to ask and ask again.
Yeah, and I think you're right, because it also comes back to a question we've just had posted, which is the question around the screeners feeling confident about having these conversations with dads. And that there's some research that shows that midwives and MCH nurses don't actually feel confident in doing that. And that's where, unfortunately, at this stage, you'll need to shop around a bit is probably necessary. So, and it just, I think, reinforces that point as well. And Narelle, sorry, I forgot to finish off with you, actually.
Oh, no, that's okay. I think for me, success with what we're doing will be when families, men, women, everyone, they get the help they need, when they need it, where they need it, in a way that's appropriate to their family, their culture. So, there's a long way to go, but there's lots of little things that we can do that start heading us in that direction. And I think, I know for me as someone who's been a health provider for a very long time, it can be really easy to get overwhelmed by how much there is to change. But when I look back at where we were 25 years ago, when I started in my job, I can see that we've come an incredibly long way. So that's really heartening. And we just have to keep pushing and advocating and seeing those opportunities for change. And we can all do little things all the time.
Yeah, and you're right. And I think in a nutshell, basically, it is a collective effort. And that's what you're all saying, and that there's bits and pieces we can all do as we go through the journey. And even if we're standing outside of it, there are things that can be done. Like on that note, I'd just like to say thank you, Narelle, Luke, and Jackie, for your time, your intellect, and your expertise. It is greatly appreciated. But before we close, I'd just like to thank actually all of the panelists for our 5 webinars. They've all given up so much time and effort to share with our audience and YouTube channel participants their own experiences, their knowledge, but their lived experiences. And people like yourself, Luke, and we've had Adam and Tom and others who have all had these lived experiences that I think have brought real knowledge to the rest of us. So thank you very much for doing that. I'd like to thank the many endorsing partners and their organisations who have put their names to the case for change. That's actually really helped in terms of giving it some legs. And we've got to make sure the change is from the bottom up and the top down. And I'd also, of course, be remiss of me not to take this opportunity to thank the amazing and highly capable team of people I have that props me up every day of the week, the team at Healthy Male. They're highly dedicated, and I'm very proud to say that I get to be a part of what they achieve every day. Special thanks goes to Vanessa Jones for her tireless work in bringing us the webinar series. You don't get to see her, but she's beavering away in the background there and make sure it all happens. And Alison Pipers and Alison Coughlin for applying their considerable intellects to the Plus Paternal project. So when this session closes, there's going to be a brief feedback survey. And when I say brief, you should know by now, it means brief. So if you could just click on a few of those little answers, that'd be awesome. And just want to say again, thank you very much. This is our last one in the series. So thank you for persevering with us, and hope you got something out of it. If you've got any suggestions or any feedback, please make sure that we get it. And please take care, stay safe. CNN and Fox News are asking us to get off because we're really denting their presidential election ratings. So it's time for us to finish, and thank you again. It is greatly appreciated that you've spent the time with us. Thank you and goodbye.